Have you or a loved one been injured in a motor vehicle crash and are wondering what to do? Have you been told that you have whiplash, told it'll get better over time, but yet you still hurt? Hi, I'm Dr. Matthew Collins. I'm a chiropractor who is board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, injuries from motor vehicle crashes are conditions that I've been managing for decades with my patients. Please note, these videos are not a substitute for professional medical or chiropractic advice, diagnosis, or treatment. These videos are for informational and educational purposes only. So just what is whiplash? Well, the term whiplash is not a diagnosis any more than the term sports injury is a diagnosis. Neither of these terms tell us anything about what tissue or tissues were injured. If I told you that I was diagnosed with a sports injury, you would wonder, did he hurt his knee? Did he get hurt in the head? Did he twist his ankle? Just what was injured? Well, that's exactly what happens when patients are told they have a whiplash injury. Maybe for a minute or two, they might feel comforted being given a diagnosis, but they quickly realize it doesn't explain just what is injured. So both of these terms, whiplash and sports injury, are really a description of a type of mechanism of injury. In fact, some sports injuries also meet the definition of a whiplash injury. How confusing is this? So the whiplash injury is where the human body has outside forces that violently whip it back and forth, moving it faster than the body can react, resulting in internal tearing and damage of tissues. Now, car crashes in particular are a unique form of trauma. This is where forces of compression and tension, shearing and rotation can combine in a rapid sequence that is virtually instantaneous and causes internal injury. So rather than saying whiplash anymore, a more appropriate term would simply be spinal injury. Now, patients who visit our chiropractic clinic for injuries sustained in a car accident are frequently suffering with what many people suffer with that are injured in a motor vehicle accident: headaches, neck pain, back pain, dizziness, numbness and tingling, radiating arm or leg pain, disrupted sleep, and difficulty returning to work. A common question we have is, why am I in so much pain? Why does it hurt all over? Well, the pain from a car crash is the result of tissue damage. In addition to the pain from the actual tissue's damage, there's also inflammation, especially in the early stages, that comes from the damage, and this causes even more pain. The forces that whip the human body back and forth are not highly precise forces. They're not like a smart bomb that targets one piece of tissue and abandons and leaves everything else perfectly fine. The forces are large and destructive, and oftentimes multiple tissues in the body are injured. This model here shows a piece of the human body, a piece of the human spine. These bumps right here are the bumps that you feel in the back of your neck. This right here is a healthy joint. This right here is a red and inflamed joint. There's nerves that go into that joint. This right here is muscle that anchors to the part of the bone. This right here is spinal cord, and this right here are nerve roots that would end up going down the arm or down the leg. So all of these tissues in the spine can be injured in a motor vehicle crash. So it's common to see disc injuries, spinal facet joint injuries, brain injuries, nerve injuries, and even extremities such as shoulders, elbows, wrists, knees, ankles, and feet. The severity of bodily injury is possible in a car accident, and it depends on the health of the person, the quality of their tissues, the type of injury, and many, many factors. So let's briefly discuss the most common injuries. There are several tissues that, if somebody is injured, will almost always be involved. And these tissues are the two types of connective tissue and muscles. The two types of connective tissue would be the ligaments and the disc. And then, of course, the muscles right here are the ones that we have that in all of our arms and our legs and that surround our spine. Connective tissues are made of ligaments and discs, and ligaments are straps that hold the bones together, and the spinal discs are shock absorbers between the bones. They also act to hold the bones of the spine together, and they also allow for some motion. Now, a muscle injury is called a strain, and a ligament injury is called a sprain. Together, they're often rolled together into a phrase called a sprain-strain injury. With ligaments and muscles, there are three grades or three levels of severity of injury. There's grade 1. That's where there's internal tearing with some pain and swelling. Then there's grade 2. This is where the internal tearing results in partial thickness tears, which may or may not show up in imaging. It all depends on the tissue being evaluated and the quality of the imaging. Then there's grade 3. This is where there's full thickness tearing and or rupture. Oftentimes there's gross joint instability and they may need surgical intervention. So these sprain strain injuries are easy to diagnose, at least initially. I mean, they're diagnosed clinically with an appropriate history and a physical exam, but many doctors just stop at this point and they stop. They don't determine the exact location of these sprains, and oftentimes they don't even diagnose what grade it is. So this is another reason why seeing the wrong doctor can result in an incomplete diagnosis, wrong treatment, and persistent pain with poor recovery or no recovery. So long term, what happens with these sprain strain injuries? Will it just get better doing nothing? Just wait it out? Well, rarely are there things in life that get better by simply being ignored. We all kind of know that. And regrettably, the same thing holds true here. Sprain strain injuries are tearing injuries. These tears, unfortunately in adults, are not replaced with original tissue. Your normal, healthy, elastic tissue is now going to be replaced with less elastic scar tissue. Torn muscle tissue does not replace with new muscle tissue, it replaces with scar tissue. Regrettably, the research shows that over half of those who are injured in a motor vehicle crash and have neck pain will have neck pain up to a year after their motor vehicle crash. So seeking early and appropriate treatment, like the type that we provide here at our chiropractic clinic, is critical. If you were riding with others, it's possible that they were injured too. It would be best for everyone who has symptoms to be examined as soon as possible. Now, regrettably, some tissues can be injured that will lead to long-term pain. For example, according to the North American Spine Society, the most common source of long-lasting pain from a motor vehicle crash is injury to the facet joints, injury to the disc, or actually both. It's possible to have facet joint injuries at the level of disc injury. Muscles are rarely the cause of long-term symptoms. So if you're still in pain and relying only on exercise, you might need a new spine evaluation. So how do we do it here? Well, injured patients are oftentimes reluctant to see a doctor of chiropractic because they're worried about beginning any treatment, especially without a proper workup. This is understandable. No injury should ever be treated without a complete evaluation to diagnose what was injured and how badly it was injured. It is important to begin with an accurate evaluation locating all of the bodily damage to determine a complete diagnosis. And that's what we do. At Twin Cities Headache, Neck, and Back, we don't begin with treatment. We begin with a complete exam to reach a complete diagnosis. This starts by listening to your history, identifying all of your symptoms, and then follow this up with a methodical physical exam using orthopedic, neurological, and musculoskeletal examination testing. Based on your symptoms and based on the exam, the injuries might require imaging such as X-ray or MRI in order to fully visualize the location and severity of tissue damage. Now, with the proper exam resulting in a complete diagnosis, then we can create what's called an evidence-based treatment plan. This is created based on the research patient preference and it maximizes patient recovery. Common treatment tools and approaches that we use here are chiropractic spinal adjusting. We use low force techniques that are very comfortable and are relieving. We do not do the high force ones, especially initially. We can also do manual therapy, acupuncture, dry needling, traction, rehabilitation, stretching, and home exercises. Most, if not all, patients who are injured will require some sort of medical care in combination with the chiropractic care to speed up pain relief and to maximize recovery. Common medical referrals that we make include radiology, neurology, sometimes sports medicine. We sometimes do interventional pain medicine for injections. Sometimes we even have to do orthopedic surgery and neurosurgery. So when should you see a chiropractor after a motor vehicle crash? Well, the answer is as soon as possible. However, you need to make sure you don't just see just anyone. You need to make sure that you see a trauma qualified and trauma trained chiropractor as soon as possible. Once again, seeing the wrong doctor can result in an incomplete diagnosis, wrong treatment, and persistent pain with poor recovery or no recovery. So if you or someone you know has been injured in a motor vehicle collision, get examined right away at our clinic. We are here to help you. Please call us at 651-925-5530 to make an appointment today to be examined. Thank you and have a blessed day.